The next speaker is Bob Wold, who is the founder and president of Clusterbusters. Bob is quite revered in the cluster headache circles, and he's on a mission to help people with cluster headaches, and he's going to talk about some of his work and cluster headaches. So without further ado, Bob Wold.
Thank you very much, Bruce. A couple different things we'll be going through today. Number one is we'll take a look at some of the changing attitudes with psychedelics and how they've applied to cluster headaches. One of the things that Tom talked about earlier was when two different groups come together with ideas, that they sort of validate each other. And most of the work with psychedelics over the years has dealt with mental health issues and different work with that. I'm here to talk about how psychedelics can actually help a physical condition. And it's not just a physical condition, it is a very dramatic physical condition that a lot of people don't know about. The group that I started was formed back in 2002. The story actually starts back in 1998, where psychedelics were mentioned as a treatment for cluster headaches. There was a social network online with a lot of cluster people talking about what treatments they can use, and somebody showed up from Scotland one day and asked the question if anybody had ever heard of using LSD to treat clusters. So from that point on, a few people got together, started doing a little bit of research, and found that actually when LSD was discovered, Dr. Hoffman was actually working on headache treatments, and all of that early research was buried along with everything else for a long time. A little personal look back in time here. I was in my mid-20s. This is a typical time for cluster headaches to hit. People starting their families, buying their first home, and being hit with something that they have no idea what's happening. And if you just take a look at this one slide on the right, the purple nerve is the one that's involved here. And the fact that it comes down into the jaw and the teeth causes a lot of problems with early diagnosis. So my story started out when I was in my mid-20s, raising my family. I went through 20 years of cycles, twice a year, and these headache cycles would last 3 months apiece. Then they would go away for 3 months and they would come back again. Over those 20 years, I used 75 different prescription medications in hundreds of combinations. This is a list of most of them. Some of them are pretty interesting. I actually had a prescription for cocaine. I was on very high doses of lithium, other things, fentanyl patches, which is a painkiller mostly used for cancer patients. A lot of other very powerful drugs. Prescribed methadone for pain, that didn't help. So this is the rest of the list, and a partial list of some of the non-prescription things that I would try. On the right-hand side there, the one thing that's listed is root canals. If you remember where that nerve was on the side of the face, 40% of people with cluster headaches end up in a dentist chair and having some sort of surgery, either TMJ, root canal surgery, and it's something that's being done that will not affect your cluster headaches. It's just a misdiagnosis. One of the things that's actually been good about social media, and there are a lot of bad things about it, but one good thing is that it's really helped with the diagnosis time. When I was diagnosed with cluster headaches, the average diagnosis time was 8 years, and it's gotten down to 2 years now. And a lot of that is just because of everybody being online, being able to talk to each other, being able to find out what they've got before their doctors know. Cluster headaches are the #1 most painful condition known to man. So when we're talking about psychedelics treating a physical condition, it's not just a physical condition, it is the most painful condition known. There are no painkillers that'll touch it. If you want to try morphine, you need enough morphine to knock you out. So, how long are we supposed to wait and follow all the rules? The first mention of cluster headaches dates back to 1641. The first really full description of cluster headaches, which meet the Headache Society guidelines, was in 1745. Up until today, the only thing that has ever been brought to market to treat cluster headaches is oxygen. Everything else, all those other 75 medications that I tried and that everybody else tries, is just a hand-me-down from either migraine or you name it. I mean, the doctors are willing to try just about anything. So how far have we come? This is the way they used to treat people that probably had cluster headaches. And this is the way that most of the treatment dollars are going these days on the research. Once again, they're invasive surgeries, deep brain stimulation, which is putting wires down into the hypothalamus in the brain, microvascular decompression, drilling another hole in the back of the head, the gamma knife, which is actually killing off part of the brain. After I had tried all those medications, these were the options that were offered to me until I started seeing another option online. And that's where I started doing a lot more research for myself while I was sitting there trying to decide which one of those surgeries I was going to try. With all the talk that was going on online, people started trying psychedelics to treat their cluster headaches. But obviously it wasn't something they could go to their doctor and ask for a prescription. But they were having great success with using psychedelics to treat their cluster headaches. So in 2002, I formed Clusterbusters so that we could start to try to get it as a prescription medication. At least try to get some clinical trials going to find out if it actually does work, and see where the research may lead us. At that point, and still today, the conventional options that we have, ergotamine, which is taken from a fungus, which has been around for years and years. Originally was used to control bleeding. So there are still some medications that are used to treat cluster headaches that are ergotamine based. The surgeries that I talked about and scores of different medications. An interesting one is Imitrex injections, which were developed for migraines, but they do work for cluster headaches. The problem is, when somebody has a cluster headache, they're normally getting 3 or 4 a day, and you can't take 3 or 4 of these injections a day. On top of that, they're about $180 per injection. And if you have a heart condition, you can't take it. Other interesting thing about Imitrex and how the pharmaceutical industry works, the first year that Imitrex was on the market, 9 people died. in thousands of years of people using mushrooms, I don't think that there's one case that anybody's died of eating mushrooms. But Imitrex and the other drugs that are like it, it's a $9 billion a year industry now. So we were out looking for some new options for people. The first ones, with the first report of being LSD, it was very difficult for anybody to find, so everybody started to find out that psilocybin and mushrooms was very similar and started using that to treat their clusters. Also the morning glories, and there's some other seeds that have a very similar structure, LSA rather than LSD. As far as cluster headaches go, for you that may not have ever seen anything like that, sometimes I'll show a video of somebody with a cluster headache, and I can tell you that it's a lot scarier than Snow White. And I have had adults leave the room. Administrators have to turn their heads. So I'm not going to show any videos of a cluster, but there was a very good article that just came out that I'll read here for you, just a short passage. Accounts abound of sufferers begging family members to end their misery, bashing heads against the walls with their fists, and worse, taking aim at the source of the pain with drills or other household weapons near at hand. Dr. Anne McGregor of the City of London Migraine Clinic described in a recent interview the x-ray of one sufferer who pointed a shotgun at the offending eye socket and pulled the trigger. Despite inflicting massive brain injuries, he survived the blast. The source of his pain, located deep in the head, undoubtedly survived also. So you can see it's not just the headache, although it is called a cluster headache, which is a little bit difficult to reconcile sometimes. The similarities here with between psilocybin, which is the compound found in mushrooms, and serotonin, which is a neurotransmitter in the brain, is the indole ring. You can see that right here, and you can see that in the psilocybin and the serotonin, which means they're going to be sitting in very similar areas in the brain, in the brain receptors. So after I formed Clusterbusters, I tried to get some people to listen. And not only could I not get any doctors to listen, I couldn't even get anybody that played a doctor on television to listen to me. Nobody would answer my emails. Nobody wanted to talk about it on the telephone. The interesting thing is that they all understood the relationship, but they didn't want their name on an email talking about psychedelics. So it was very difficult for me to get anybody to listen to what was going on. I finally did find somebody, and we ended up at Harvard, of all places, which had really turned away from all psychedelic research ever since Timothy Leary was kicked out. So this work was actually the first work that was done with psychedelics in probably 45 years at Harvard. What came of that was a study that was written up in the peer-reviewed journal Neurology. Just show you a couple of the things that were on here. 52 patients had used psilocybin, 9 used LSD. 22 of the 26 psilocybin users reported that psilocybin aborted attacks. 25 of 48 users and 7 of the 8 LSD users reported a cluster period termination. Cluster headaches come in groups, like I was talking about before, where you may get 3 or 4 a day for anywhere from 6 weeks to 3 months. They come almost at the exact same time every day. So if you get one at 2 o'clock on Tuesday, you're going to get one at 2 o'clock on Wednesday and Thursday and Friday day after day until your cycle ends. Very low doses of psilocybin or LSD not only would abort a cluster headache, but in many cases it would completely stop the cycle in its tracks. So if you're looking at a 3-month cycle, you took it 2 weeks in, it would end rather than go on the entire 3 months. So that was the first big break for us, was getting this actually published in Neurology, and we started building on that. The treatment is, the first thing you need to do is stop all the medications that you have been using. What we did find was when people stopped the medications that they were using for their cluster cycles actually got better. Their headaches weren't as intense. Some of them went from 3 a day to 2 a day. So as afraid as they were of stopping the medications that they were using, we're actually finding that most of the medications were actually making their cycles worse and last longer. The treatment consists of 3 doses. It's not something you take every day. Each of the doses is actually very small, usually about a quarter of what would be a recreational dose. So it's not like you're sitting at home counting the pink elephants in your room. You aren't hallucinating, and most people report that the side effects from the dose are less than the medications that they had been using for years. It's 3 doses, 5 days apart, and in many cases it will stop the entire cycle and not just the headaches for that day. So the success rate that we were looking at, the 200 people that we looked at, of the 9 that tried LSD, as I said, LSD was very difficult for anybody to find. Most of the people that were getting started in this were the people that were very desperate, that had clusters for 30 years, 25 years. They had tried everything. They were willing to try this just based on meeting a couple of people on the internet talking about this. So you can imagine the leap that they were taking. Most of them had never taken any psychedelics before. Most of them weren't able to find LSD. It's not like they were, walking around their college campuses. Most of them, executives, police officers, whatever they may be. So a lot of them were able to try mushrooms, which they would either find from somebody they know. Maybe they've got a college-age student in their house, or they would grow their own, which is very easy to do. And 80% of those 191 people reported a break in their cycle, a complete stop of the cluster headaches until the next cycle would come around. The picture on the top was a 1-month supply of medications that I actually came out of the hospital with. One time I was on 15 different prescription medications. That was a 1-month supply. And I replaced that with the 1-year supply of psilocybin on the bottom, which was 2 doses, 3 capsules. That was it. And I grew my own. What's going on now is we have a large medication survey going on at Yale School of Medicine. We're continuing to work on bromo LSD, which I'll get into here in a minute. And also we're working on post-traumatic stress disorder. The medication survey that we have going on, we had to close it off at 651 respondents, which is a huge number when you're talking about cluster headaches. There are 400,000 people in the United States that have cluster headaches, but trying to find them is very difficult. If you talk to a doctor, if they're lucky or unlucky enough to have 1 or 2 in their entire career that they might see. So once again, this is a benefit of the internet where we were able to reach out to people And what we're looking at here is trying to compare how well psychedelics are doing for people versus some of the other medications that they're on. One thing that we've found is when some of these medications come out of a clinical trial, the pharmaceutical company selling them is going to come out and tell you that, it's 80% effective. Well, that may have been in a clinical setting, but in real life, when you start talking to people with cluster headaches, nothing is 80% effective. So what we're trying to do here is really compare what is really happening with the medications that people are using. One of the offshoots of our work with psilocybin and LSD, while we were trying to get to a clinical trial on that, we did a small trial in Hanover, Germany. The researchers at Harvard teamed up with some researchers in Germany and did a small clinical trial on, it has many different names, but it usually goes by either BOL or bromo-LSD, which is an LSD molecule with a bromide molecule added to it so that it doesn't cause hallucinations. It stops that part. It doesn't quite fit into the receptors the way it should. By doing that, you can take a very large dose of LSD, basically, without any side effects at all. BOL 148 has been around for a long time, since 1957. It was used for a lot of different things, but not very often, just because it was usually used in other studies where LSD was looked at. But all the safety trials were done, and it was being used safely for a long time in the labs. What came of that small clinical trial that we did was, once again, the people were given the BOL just as if they would have been given either LSD or psilocybin, with the 3 treatments that was really kind of perfected by Clusterbusters and everybody else online. Just years of self-research, I guess. 4 of the 5 reported completed remission, and 1 had a major decrease. One of the triggers for clusters is alcohol, and that 5th patient just couldn't give up his alcohol. But this is a chart showing their headache activity and how it was following the 3 doses. On the left-hand side, there was a number of attacks. This guy right here was, I think that's what, 45 or so. And after his 3 attacks, I mean, he was down to less than 5 a week. And that was after just 3 doses. And not only did it stop those, but back on they were still reporting the same sort of remission 16 weeks later. So the big thing is everybody's trying to figure out why this is happening. Why is there an effect after either the LSD or the psilocybin or the bromo-LSD has left the system? Why is the brain no longer sending those signals to create a cluster headache? And one of the theories going on right now is that it's a matter of epigenetics, which is actually changing the way the genes express themselves. It's actually trying to reset the brain, telling it to stop doing what you're doing and act right. And it's actually having a long effect on basically resetting the brain to not misfire and create cluster headaches. Another thing that we found out while we were doing all of this was, and that's a picture that was drawn by a cluster headache sufferer on the left, trying to depict what one feels like. But after talking to a lot of people that had treated their clusters with psychedelics, there was a huge change in not only their headaches, but a huge change in their outlook on life. And you can imagine with cluster headaches, there are two different types. There's a episodic where, as I was explaining, you can get them for 3 months and then you get a 3-month break before they come again. And there's also a chronic stage where you never get a break, and you may have those headaches every day for 20 years. So you can imagine, even if you're out of cycle and waiting for the next one to strike, if they've come the 4th of July every day for 20, or every year for 20 years, you're not really looking forward to the 4th of July. So we really noticed a big difference in just talking to the people that had been treating their headaches with psychedelics. And it seemed to be such a profound change that everybody was really on board for trying to get information out to other people with cluster headaches. Sometimes to the point of getting other people mad at them, or because they would be so vocal about, you need to try this. Some people had to temper their enthusiasm a little bit, but there was a big change. And what we found out was chronic pain. Researchers found 50% of patients with chronic pain, some sorts of chronic pain, could develop post-traumatic stress. So we started looking at that to find out if people with cluster headaches were suffering from post-traumatic stress. And it is nothing that ever had been looked at previous to this. This is just a little bit of a scoring sheet that's used for this. People with headaches would fall into the civilian primary care. Scores over 25 mean you should start looking at it. And you're going to have a diagnosis of post-traumatic stress if you're in the 30 to 38 range. People with cluster headaches that we started scoring, their average scores were 47 if before they used any psychedelics. So they were way over the diagnosis for post-traumatic stress. After they were treating their headaches with psychedelics, they were in the low 20s, and they were no longer in the range of a diagnosis for post-traumatic stress. And this is all being done self-therapeutically. It's not like they're treating their post-traumatic stress in front of a therapist. This is just themselves sitting in their living room feeling better about themselves and trying to get their head wrapped around living with cluster headaches. So the decrease in the scoring with using psychedelics, the average was 48%. And this was usually from 3 doses. This is just a chart that shows that those numbers in the drops, the percentages of drops carried across the board, whether it was male or female, chronic or episodic, whether they were in cycle or out of cycle. We saw just dramatic drops in their post-traumatic stress disorder scores. So one of the things we're talking about here is changing attitudes. And back in 2002, when I formed Clusterbusters, when nobody would answer my emails, we've come quite a way in the last 10 or 11 years. The last couple of years, we've taken a group of people to Washington, D.C. We've been not only accepted, but are part of the board of directors of the Alliance for Headache Disorders Advocacy, which is a large group of all the top headache foundations in the country, and have gone to Washington, D.C. the last couple of years asking for increased funding, working on some issues with Social Security. Cluster headaches, one issue is it's not even listed in the Blue Book of Disabilities for Social Security. So it's almost impossible for people with cluster headaches to file for disability, let alone get it. It's just very difficult. But the point that we're sort of trying to come from here is, at least if it's in that book, it's going to validate that we're out here. I mean, at this point, we aren't even listed in the book. We went there in 2012, and we actually got some funding reallocated from the Department of Defense. You got to find your dollars where you can find them. But we've had very good luck walking the halls of Congress. Other headache groups have not only accepted Clusterbusters and people that are using psychedelics, they're not only answering our emails now, they're attending our conferences. We're joining other conventional organizations. There's a new one that is basically patient-based, the American Headache and Migraine Association. We're one of the founding members of that. One of the other things that we were able to do last year was we met with the head of SAMHSA in Washington, D.C., which runs the suicide prevention lifeline for the country. And when we met with them, they had never even heard of cluster headaches. And the nickname for cluster headaches are suicide headaches. And the government agency in charge of suicide prevention had never even heard of cluster headaches. So we were involved with writing up some fact sheets and doing some training for the people that answer the phones for SAMHSA and their suicide hotlines. And we continue to work with them on that. Once again, we get out to a lot of different conferences trying to talk about treating cluster headaches, making people aware that cluster headaches are out here, making people aware that psychedelics don't just treat mental health issues or those sorts of things. They can actually treat physical ailments. And not only do they treat them, but they treat them pretty well. And that just, one of the profound things about psychedelics for treating cluster headaches is all of those medications that I was on and that everybody else has been on for cluster headaches. You can always still feel it in the back of your head. Your head still feels like it's a balloon ready to pop. Some of those medications just temper some of the sharper pains, but you can just feel that all those medications were used to try to cover it up. Whether it was high doses of Topamax when you couldn't remember where your car keys were, or lithium where you couldn't remember where your house was. The difference with the psychedelics was the first time that I tried it, my head was so clear, it hadn't felt that clear in 20 years. I completely felt all the pressure drained from my head. And just that feeling where you can tell the difference between treating your clusters with that rather than trying to cover it up with strong other medications, painkillers that don't touch it. It's just a huge difference that you feel immediately. Once again, we go from nobody answering emails to getting published in Neurology. We've gotten to some different research summits. We've been written up in all the top headache journals, all the top medical journals, The Lancet, being accepted by all the different large headache societies. Mainstream press. This is something that psychedelics made it very difficult to open some doors early on when we were trying to get this. On the other side of the coin is, I ended up on the front page of the LA Times talking about treating my cluster headaches only because I was treating them with growing my own mushrooms. if I was just talking about treating my cluster headaches with lithium or something else, I never would have made the newspaper. So the fact that some people were willing to reach out to this story because of the sensationalism of it, I didn't care why people were opening the door, I just wanted them to open the door. So if that's why they wanted to write that story and put it in the Chicago Sun-Times, it has gotten us a lot of publicity dealing with what we were dealing with. It has certainly caused a lot of roadblocks and a lot of other problems, but there's good and bad about everything. There have been 2 National Geographic documentaries. One was on the Broma LSD and the research being done with that, and the other one was a guy with cluster headaches. They showed him treating his clusters with mushrooms, how he grew them in his house, basically, and was treating his cluster headaches. And the first doctor that ever prescribed mushrooms for cluster headaches was Dr. House on television. They actually ran 2 episodes. One he treated a migraine with LSD, and one he treated cluster headaches with magic mushrooms. And the writers got all of their information off of our website. Back to talking about suicide headaches. The numbers are hard to be real clear about sometimes. There was a large study done that said that 55% had thoughts about suicide, while 2.2% had actually tried to commit suicide. And those numbers put the suicide rate 20 times the national average. A study that we did showed that over 9% had actually tried to commit suicide. 65% had seriously considered suicide, and most of those people don't consider it just once, they consider it often. Another thing about social media these days is you get to know an awful lot of people. So you're able to help some people and you're able to support each other, but the downside is you end up knowing a lot of people that end up committing suicide over the years. So that's really something that drives an awful lot of us to keep pushing on this stuff. This is a person that from Milan that certainly looks like she's living in a little bit of paradise there. That's her swimming pool. She had a going away party at her swimming pool one night last year, a little less than a year ago. And then the day after that, she committed suicide because of her cluster headaches. It's a terrible condition that people are living with. And many of them have been, thousands of them now are treating their clusters with psychedelics. So that's a 10-year synopsis of Clusterbusters and cluster headaches. So we're still doing an awful lot of work. We have a lot of research going on, a lot of advocacy work, and everybody at least is starting to listen and getting the word out. So that's where we're at. So happy to answer any questions.
Bob, can you talk about, does this sort of treatment work for migraine headaches?
From all the reports that we have, it works even better for migraines than it does for cluster headaches. One of the things when we were starting out with Clusterbusters and trying to get people to do some research on this, we had already heard that, and we had figured that it would help migraines also, just because they are similar, and similar medications like Imitrex will treat both of them. But we also knew that it's a $9 billion industry in the pharmaceutical industry treating migraine headaches. If you can treat 3 months worth of migraines with one capsule of ground up dried mushrooms. The pharmaceutical industry doesn't really like that. And that's been one problem with us trying to get research done, is because, number one, we're a small patient group. There's only 400,000 of us or so in the US. And number two, you want somebody to develop a pill that they're going to take 3 times a year. So you can imagine what they would need to charge for that pill. You know, a lot of the medications these days, you know, run upwards of $100 million to bring to market. So you can imagine what they would want to try charging for that. So most large pharmaceutical companies don't want to, you know, even get involved in this. And some of them don't like hearing about psychedelics because they're able to sell $9 billion worth of Imitrex every year. And we did actually have there was a research center that was going to be doing some work with us until the pharmaceutical company that usually paid 100% of their research funding for the year threatened to remove their funding. But to answer your question, yes, it can treat migraines. We found that out by the wife of a cluster sufferer was chopping up dried mushrooms, getting ready to make some tea for her husband to treat his cluster headaches, and she had a very bad migraine. And she actually absorbed enough psilocybin to her fingertips just by chopping up the mushrooms that it cleared up her migraine. And it was gone for 3 months. And I had another report from another guy that was a young guy, didn't know how to explain to his mother how he was treating his cluster headaches until she called him one day, and she had a very bad migraine. So he said, "I'm coming over, I'm going to talk to you about my clusters." And he went over there, had her hold out her hand, put some dried mushrooms in her hand, and he said, "I want you to hold on to these while I tell you what I'm doing for my clusters." So he started explaining that he was treating him with magic mushrooms. By the time he got done with the story, his mother's migraine had cleared up just from absorbing the psilocybin through her hand. So she, was, immediately understood how it could be helping him. So a lot of people are using them to treat their migraines these days. But yeah, there's 30 million migraineurs out there that could benefit by this.
First, I'd like to commend your advocacy. I think you've been pretty phenomenal in terms of what you've been able to achieve.
Thank you.
Given that you've got a lot of research popping up across a variety of spectrum of other diagnostic categories now, have there been efforts on your part or any others to kind of work across these diagnostic categories, or has there been some thought to create like an overarching advocacy group that could advocate for the use of psychedelics?
Well, it's a complicated issue because different groups have different agendas. One thing that we tried staying away from the very beginning was getting into any legalization debates, just because we figured we would leave that up to somebody else, and we wouldn't want that argument trying to slow down the research that we were trying to do. But just like with our work with post-traumatic stress, we are talking to researchers that are also working on other areas with psychedelics and depression and anxiety and things like that, and post-traumatic stress. So yeah, everybody's starting to come together and work together, and that's also something that I've seen a big change happen over the last 10 years. Is that everybody seems to be coming together a lot more and working together, and some of those divides in the groups in the psychedelic world are trying to come together. And some of the, you can see that in some of the conferences that are going on now. They're just, it's a wider range of people that are showing up at these things. So yeah, we're all trying to work together these days. So.
What kind of money does it take to get the attention of the medical academics so that you can have have some of this research done?
Well, that's a good question. It's not just a matter of dollars, but it's also a matter of who's going to do it, and whether or not they're willing to do it. Just trying to get small clinical trials through their IRBs are just very difficult, and so.
Did the Harvard group have to go out and get their own meds or their own substance?
Yeah, well, the study that we did in Germany, actually with Harvard and the Hanover Medical School, it cost us $10,000 to buy enough bromo LSD to treat 5 people. So, when you're just looking at things like that, the dollars add up very quickly. When we were originally talking to Harvard about doing the study there, the clinical trial, where we were hoping to do for like just 25 people, and it's a 10-day treatment. You take the one dose and you wait 5 days and you take another dose, and then on the 10th day you take the 3rd dose. Well, Harvard wanted those 25 people to be in the hospital for all 10 days. And there's absolutely no reason for that, but that was one of the things that they thought they needed to do. So you can imagine what that would add to the cost of a small clinical trial someplace like that. When they put those sorts of restrictions on you, the dollars add up very quickly. They're talking about needing upwards of $20 million to try to get bromo LSD to the point of phase 3 clinical trials. The early clinical trials that I showed about all the animal testing and all that had been done back in the 40s and 50s. Well, now the FDA says, well, that's too old. So now you got to redo all that again. Okay, so we got to give more animals bromo LSD, but I don't know why that it doesn't. That early work, doesn't count anymore. But those are just the obstacles that are put in front of us every time we try doing something. So, if it was just a matter of writing a check, I think that I could probably get somebody to write the check, but it's not that easy. We were in front of the FDA recently trying to get cluster headaches approved as for orphan drug status because of the low numbers. There's so few of us that nobody wants to develop new medications for us, but there's too many of us to fall under orphan drug status. So we were just turned down for that, which would have made it a lot easier to work with. It would have given a couple more years of patent protection for the company and for Harvard, basically, that holds the patent on it. But there's just a lot of obstacles in the way. So.
But it's a preventive too, right?
It's a preventive, yes. Yeah, it stops the cycles. If somebody feels a cycle coming on, they normally take a dose and the cycle won't start for most people. It's not 100%, but unfortunately we aren't able to do a lot of studying of it in a clinical setting to see what we might be able to change a little bit so that it is more effective for even more people. 80% is pretty effective, but it's the other 20% that, yeah, and most people with clusters, if you ask every one of them, they're going to tell you that they always fall into the 20% that medication, that those 75 medications didn't treat. So it's just a matter of being able to work with this. If we weren't able to do that original work with LSD and psilocybin that was written up in Neurology, we never would have been able to get to bromo LSD. Now we're talking about something that's perfectly legal, it's non-hallucinogenic, and we never would have found that if we wouldn't have been doing research with psilocybin. So it opens up so many other doors and other ways of trying to find out what is really going on what's causing the headaches. For psychedelics to treat it longer than it's actually in the system, I think that's a pretty good clue about being able to work backwards and find out what's causing the clusters and why the hypothalamus is misfiring. So, those are the kinds of clues that we need to be able to research. So.
I'm going to pick up from what the earlier gentleman talked about. The overlay or possibility that this is related to, or similar to other kinds of neurological pain. I'm thinking specifically of spinal stenosis and the whole pain management area with that. Have you found any sort of integration or parallel on that, or is that yet to be researched?
Well, I have talked to quite a few people that have other forms of nerve pain. Most of the people I've talked to have, facial pain. There's 160 different types of headache classifications, and a lot of them revolve around the same nerve that is affected with cluster headaches. And those sorts of neuralgias, I've talked to a lot of people that have tried psychedelics to treat them, and they have worked for them. And once again, it works for longer than it's actually in your system. But there's one form of headache that's nerve pain. It's similar to clusters. It's called SUNCT, S-U-N-C-T, and it's a very bad facial pain. And I think I've talked to 2 people that have that, and both of those people had relief using psychedelics to treat that nerve pain. But to start, you can make those connections, but I think there are probably tens of thousands of people with SUNCT that should be able to try this, and need to look at that. So there are connections with other types of nerve pain, especially when they're related that I know of anyways in the face. So.
You know if cluster headaches are inherited?
Cluster headaches, there are some signs that the risk of inheriting them is about 10% higher if they are in your family. There's a 10% more of a chance of having them. A lot of cases that I've talked to people, they've skipped generations. But yeah, and so the risk is slightly higher, and I can tell you that it is the biggest fear that anybody with cluster headaches has is, as soon as they start having kids, their biggest fear is that their kids will end up with that because, it's one thing for you to go through it, but to worry about seeing your kids go through it, it's a pretty devastating thought. So.
My husband's one of 7, and 3 of them have it.
Wow. That's
2 males and a female.
That's not that's not good.
Terrible. Can you speak more about the alcohol trigger?
Well, it is one of the biggest triggers that just about everybody with cluster headaches has. When you're in cycle, for a lot of people, even if the smell of alcohol will trigger a headache. And I'm not sure why it triggers it, but it is a very common trigger for just about everybody with clusters. Most of them don't drink. They stop drinking as soon as they find out what they have and that it is a trigger. And most of them will even stop drinking in between their cycles just because, they just get used to not, drinking and staying away from it. But it is probably the most common trigger among people with clusters. So there hasn't been much research done. Nobody knows why, but it is. So. Yep.
Is there any evidence that tobacco use is linked to cluster headaches?
Well, that's the other thing. Most people with clusters smoke or did smoke at one point or another. There was one study done that by a doctor right here in Northbrook that looked at that, and people that stopped smoking that had clusters, it didn't change their clusters at all, so it wasn't a trigger. But there seems to be, there may be some connection because for some reason, most people with cluster headaches smoke tobacco. So whether there was some damage done, it's caused before it's, before the clusters start, and you can't reverse that if there is any damage. I mean, everybody looks at the high incidence rate of people that are smoking in clusters, but there certainly isn't any research that proves that smoking caused it, because a lot of people that don't smoke have cluster headaches. So I've seen people, children as young as 5 years old get cluster headaches. It's just whether or not it's a it could be that people with cluster headaches have more of an addictive personality and end up becoming addicted to cigarettes. There's a lot of different theories about why that may be, but Okay. Yep.
I wonder if you've heard of any research done with autism and psychedelics.
Yeah. Well, I did actually hear of something about that. I don't know anything about it, but I did hear that somebody was actually looking at that. When I was out at the conference out in Oakland last month, somebody was talking about looking at that. So I think they're really looking at a lot of those types of areas and hoping to be able to do some research on that.
Thank you.
So, you're welcome. Okay. Thank you.